Medicare open enrollment begins Tuesday, and there are some changes this year beneficiaries need to know about. Contact 2's Mike Colombo has the story.
For the first time in the history of the Medicare program, out-of-pocket prescription drug costs will be capped. Changes to Medicare Advantage plans or standalone Part D plans start January 1st.
The donut hole, not the good kind of donut hole, it's going away next year.
Paige Lombardo is co-owner of Health Matters Insurance in O'Fallon, Missouri. The donut hole she's referring to is Medicare's annual gap in prescription drug coverage. Beginning January 1st, millions of Americans will pay no more than $2,000 for prescription drugs, a change that could save some people thousands of dollars.
People could be surprised they might have a deductible for the first time that they didn't have previously. So the first time when they go to the pharmacy in January, they could be a little sticker shocked with how much their deductible or their copays are. But it is nice, there's a prescription payment plan that's coming out, so they could spread out that cost to 12 months for the year.
It's an incredibly important new protection.
Lee Purvis with AARP estimates the new out-of-pocket cap could help more than 4 million people save money by 2029.
On average, about 40% are going to see savings of $1,000 or more when they hit that cap. So really some significant savings for people who are often on fixed incomes.
Lombardo says it's important to read the annual notice of change you'll receive in the mail.
That'll detail everything that'll change about your plan. So some of those copays, for example, maybe you have to go get some MRIs this year. It could have been $70 copay last year. Now it might be 20% co-insurance. So it's important just to look at those details depending on what kind of things are happening health-wise for next year.
Signing up for Medicare can be overwhelming, especially for first-timers. Lombardo recommends using the free services provided by her company or others like it to make sure you're on the right track.
It's so important to really understand what you're enrolling in instead of getting a one-sided opinion over the phone or maybe a friend, family member, a neighbor. You really need the full story of Medicare and to know all of your options before you make a decision.
Medicare open enrollment runs from October 15th to December 7th. For more information on changes to the program for 2025 and how to sign up, look for this story on fox2now.com. Mike Colombo, Fox 2 News.